back to Open Your Eyes. It's all about men's health awareness and discussing Men's Health Awareness Month. We have joining us on the couch Dr. Jorge Hidalgo, and he's an internist over at Belize Healthcare Partners. Good morning.
Good morning.
Good morning, Doc. And of course, he's joined by none other than Miss Kim Simplis Barrow, and she is the National President of the Belize Cancer Society. Good morning.
Good morning.
Good morning.
And welcome back, because we have been having health conversations all of June and into July. But before we get into the conference that is to take place this week, we really want to get both your insights on the public education and awareness of men's health, and why it's important to even have these discussions in the first place. Kim?
Well, good morning, everyone. Thank you for having us. We certainly feel like the last conference that we had, which was men's under the theme for men's health, was very successful, and so we wanted to do it again with the support of the Ministry of Health and Belize Healthcare Partners and the Belize Bank. The feedback that we got was tremendous in terms of the exposure, the information that was presented to those that attended that meeting. So this year is our second year of doing this forum, which we are focusing on men's health, specifically cancer and mental health. So it's really about raising awareness. It is about destigmatizing the topic of men's health and mental health, which is so very important. It is promoting survivors who are sharing their stories so that they can inspire others. It's about providing a safe space for men to have these discussions with the experts, experts that can answer their questions. So it's immediate right there at the conference. One of the interesting things about the conference is that we have an official opening ceremony, and then after that the panels start. All the women leave the room.
Yes, I remember
because
that.
it's so important for, and we know this, men, they don't want to discuss
their issues
around women. There are a few. This year we do have a female panelist, Dr. Murray, but she's doing the first panel, and after that she'll answer questions and then she will leave.
How successful was that? Well, based on the results that you received.
It was very successful. The feedback that we've gotten was that they really needed to have that conversation. The men were, afterwards I engaged with some of them. They were very open about their experience and being able to ask specific related questions to different things. Well, Dr. Hidalgo was in there, and so he was a part of that, of those conversations.
Let me ask Dr. Hidalgo the following question. What prevents us from having these conversations openly in the normal course? Why must it be a conference or a specific space or environment for us to be having these discussions when it could be simply had between you and I at work or when we socialize or what have you?
Yeah, I think so, and thank you. It's very multifactorial, but one of the things is the way we are educated. We believe that we are powerful and we need to keep everything silent, and then we just basically share things when it's too late, unfortunate, and that's the thing that we want to change. We want to change the mentality, the culture, that the best thing is to try to seek help before things are too late. No? As probably many of you know, I'm a doctor and also, but also a critical care physician. Every day I need to face and trying to share either good or bad news to families. But then suddenly nothing prepares as a physician to be in the other side of the equation to become a patient and to deal with cancer. I mean that those things is a transformation, a total transformation to us that went through that. And then that's the reason why we say, okay, is we have a social responsibility as a physician, but also as member of the country to raise awareness and to ensure that men seek medical attention timely and that we can be able to help in the same way.
I find that it's always difficult, and Lisani or Doc, you know, could correct me if I'm wrong, but it's always difficult for men to seek medical attention. There's this underlying stigma that being sick is being weak, right? So I'm not gonna go to a doctor because he's gonna tell me something's wrong and I don't got time for that. So I don't know, help me here, because I find that to be kind of...
I'll speak for myself.
All right.
Perhaps it's fair that I do,
Yes.
right? I don't see sickness as a sign of weakness, right? No, not in its literal form, right?
Right.
But I think it's the fact that we're in denial that something is actually wrong with us, right? So for instance, you wake up, you don't feel your normal self, so you know you're off. Do I want to go and get checked out and then I'm told, okay, wow, we just diagnosed you with cancer or whatever the illness may be? No, in our minds, I'll just sleep it off or just rest and hopefully it goes away, right? I think that's usually the approach that men take. But my question, it goes back to what I was asking earlier, is that if I feel that kind of way, I internalize it as opposed to saying, okay, let me sit down with my brother, let me sit down with my dad or my coworker and just have a conversation. Maybe they could point me in a certain direction based on the description of how I'm feeling. Men don't do that enough.
Yeah, you guys are the suffer in silence kind of
Let's
type.
get to
Which is a good way to speak about Men Against Cancer, MAC, this new initiative that the Belize Cancer Society and a group of men, including Dr. Hidalgo, launched last year at the Men's Forum. So we have this organization which is there to help people like yourself, people who don't want to go and seek medical attention immediately, but they can call this organization and they can help guide them to make the right decision, to go and seek help. Because what we need to understand is if something is wrong and it is detected early, you have a greater chance of survival. And that's our objective. That's the overall objective of the Cancer Society, to ensure that everyone gets detected as early as possible, because it means that you have a greater chance of surviving whatever cancer or whatever health issues you may have. And so maybe you want to talk a bit more about the...
Yes. Well, just you say right. You know, the main purpose of those forums is to try to encourage people and also to create awareness, to bring to the attention that all these different scenarios, different situations can be, if they are getting on time, then we have a better opportunity to offer help in any way, and of course the chances of survival are better, no? But again, that's the thing, we need to break those patterns of those ideas that have been there for a while, no? And that we need to be more open and trying to communicate more. I mean, with that intention also, the forum is a very comprehensive forum. We have not only the doctors, the pathologists, the people sharing their own stories, the psychologists covering the mental health aspects, but most important than anything, we can spend time talking about the most important thing, as Ms. Kim shared, is that everybody will have the opportunity to speak up. And that's one of the major things that we see in the first forum last year. Everybody was speaking and talking and sharing, asking questions. And at the end, that's the most important and make us feel that we are accomplishing something.
And that's, I think, the beauty of that is the fact that as men, we finally have that space to be able to put our concerns forward, or to be able to just have the discussions that would enlighten us on services and how to access services and what have you. It's just a pity that it takes something like that for us to
have the conversation.
Yeah.
It's a start.
It's interesting to sorry, it's a very forward way of moving in this era of communication. I would wonder how you would be able to ensure that it's a conversation that happens after the forum is done. Because I find that we are the makers of our own situations sometimes. And again, please correct me if I'm wrong. It's just pure observation, and we're trying to do something better for ourselves. And then you sit in a group that maybe didn't go to the forum. And Isani says, guys, I went to this amazing thing. This is what we talked about. We had a wonderful discussion, etc., etc. And his buddies are like, nah, well, we know into that. And then they maybe start to pick at him doing this particular, movement.
No, so one of the things, and that's why we didn't want to do anything in a vacuum. We wanted to have some sort of continuity, and that's why the MAC, Men Against Cancer, was birthed, really, so that they can continue the conversation. So it's a group of men, including Dr. Hidalgo, Mr. Woods, Cisco Woods, Mike Singh,
Juan Carlos Dusan, Dr. Ivan De Paz.
Right, and so they do presentations. They do presentations at Rotary. I think last week you just completed a presentation at Rotary. They will be doing presentations at like all boys schools or other schools and male targeted. I think that's very important that we start at a high school level.
Agreed.
Because awareness at that level is so very important. That is when I guess our men and our girls are becoming more self-aware, and so they can pick up on things that don't seem normal to them. So MAC will be the organization that will be doing these presentations at that level to keep the conversation going. And then hopefully next year we'll have a bigger space and more of our younger boys attending. I know this year we have the Boy Scouts that will be attending. I mean, the school is out right now, but the Scouts are always very active. Participants this year will be from the Belize Police Force, the Belize Defense Force, the stevedores from Port. We have from BTL, very male-heavy organizations who don't often get the time to go to the doctor.
Right.
One of the unique things about this year is that the Ministry of Health, the Central Health Clinic through the Ministry of Health will have a clinic present at the forum to be doing some checkups. I'm not sure of the extensiveness of the checkups, but they will be there checking pressure and different vitals for some of our men, just to give them an idea that it's a simple procedure. At times, that's all you need to check your pressure.
There's no needle that is involved.
No needle.
So the forum is July 17th. That's this Thursday.
Where 9 a.m. at Old Belize.
Okay.
Yes.
And you already have your participants and so forth.
Yes, but if anyone else is
Everybody is
interested in
welcome.
attending, please call the Belize Cancer Society and so that we can register your participation.
You have it's under the theme Strong, Smart, and Self-Aware, empowering men and boys for healthier futures. I like that. I think you need to encourage men to go to the doctor more often.
Absolutely.
Definitely.
Absolutely.
In terms of what you would hope for after the end result of this forum, moving forward with men's health awareness.
Well, our main goal is we started last year, and then we're trying to from now on. I was mixed last year with the presidency of the World Federation, and it took a lot of my time. But right now, my period is ending, meaning that we can have more time and dedicated to this very important. All the group that we have involved right now are very encouraged, and they are with a lot of passion about these things. And I think so that's important. Our idea is like last month we have a couple of meetings with different groups, and we want to have as many meetings that we can schedule to create awareness. Probably go to the schools, go to different other groups that they have interest, express interest into have some guidance and also to some ideas of what to do when it comes to men's health.
Men against cancer. What is the perhaps most prevalent form of cancer among men, and what treatment and services are available locally?
Well, the most common one is prostate cancer and colorectal cancer, and those are easy to detect. We can start to do our checkups for prostate cancer starting at 40, and when it comes to colorectal cancer, it varies, depends on what strong family history you have in terms of colon cancer. Then you are due for your colonoscopy earlier at 45. But if you don't have no history, then it's at 50 years old that you should have a screening, a colonoscopy screening. Those things are available in Belize for detection. Of course, we don't want anyone to go to a more advanced treatment. Our main goal is to say that let's try to go to do those checkups, trying to get things earlier to prevent. But if we get to diagnose, we would like to have this diagnosis on a very early stage when opportunities of treatment and survival are much better.
I also think that the conversation would continue on, which we don't have to get into today, in terms of not just availability, but affordability as well for these types of treatments and so forth. But you said that they're available here, the detection, the diagnostics, they're available here.
Yes, these are available in Belize.
Awesome. Well, thank you all so much for joining us this morning. I guess we look forward to hearing the results. Well, I will look forward to hearing the results of the forum come Thursday, July 17th at 9 a.m. over at, I guess, the pavilion at Old Belize.
At Old Belize, yes. And of course, I must say thank you to our partners at the PAHO, Belize Healthcare Partners, the Belize Bank, the Ministry of Health, and yes, we hope to see everyone there on Thursday.
Hope to see you guys over there.
We'll be there.
Isana can actually sit in the forum.
Yeah, exactly. You can.
Thank you all so much. All right, we are going to take another quick break, and when we come back, we have more Open Your Eyes. Don't go away.